Welcome to Trinity Health IHA Medical Group Wednesday Wellness. Tonight's presentation is titled, What is Midwifery Care and How Can It Serve You? Our presenting providers are nurse midwives Lexi Garbus, who sees patients at our Bloomfield practice in their new location on Woodward and Square Lake Road, and Kathryn Kern, who sees patients at our Schoolcraft campus location in Livonia. Welcome, ladies.
Thank you.
Hi.
My name is Alexandrea Garbus. I've been a certified nurse midwife for 5 years. Most recently, just starting with IHA's new office in Oakland. I'm super excited to be bringing full scope midwifery to the area. I graduated from U of M with my undergrad and graduate degrees, both in nursing. And I'm currently pursuing my doctorate from U of M as well. Clinically, I am really interested in vaginal birth after cesarean or VBAC, as well as advocacy so that midwives can practice the full extent of their authority, and family planning. And then Katie's going to introduce herself as well.
Hi, everybody. I'm Katie Kern. I am a certified nurse midwife. I've been a registered nurse since 2008, and I became a certified nurse midwife in 2015. I worked for about 7 years doing full scope midwifery in Southwest Michigan in the St. Joseph, Benton Harbor area. And I joined IHA in Livonia in May of 2022. So we're coming up on a year here. I am passionate about supporting women in labor to help them get the birth experience that they desire. And I'm also passionate about promoting shared decision-making between patients and their providers in all clinical settings. And I'm excited to be here to talk with everybody today.
And happy International Day of the Woman to everybody.
Yeah. All right, so we're just going to do a quick overview of some of the things we're going to be talking about today. We're going to talk about what is midwifery and what is a midwife, a little bit of the history of midwifery globally and also in the United States. We're going to talk about the different types of midwives that are available, certification and accreditation of midwives, and also the educational facilities where they get their education. We'll talk about the hallmarks of midwifery, what midwifery looks like in Michigan specifically, midwives' philosophy of care, what midwives do in the hospital setting and in the office setting, the differences between midwives and OBGYNs, what is the difference, and is a midwife right for me? All right, so we're going to start off with some really exciting just definitions of midwifery and a midwife. And so midwifery is defined as skilled, knowledgeable, and compassionate care for childbearing women, newborn infants, and families across the continuum from pre-pregnancy, pregnancy, birth, postpartum, and the early weeks of life. A midwife is a person who, having been regularly admitted to a midwifery educational program, duly recognized in the country in which it is located, has successfully completed the prescribed course of studies in midwifery and has acquired the requisite qualifications to be registered and or legally licensed to practice midwifery. So midwifery looks a little bit different depending on the country where it's practiced, but this is the sort of broad definitions of both of those things. So the history of midwifery, I think most people know that midwifery has been around since the dawn of time. There have been women helping women have babies, take care of women throughout their lifespans. There's documentation of midwives in historical Egypt and China and India. There's mention of Hebrew midwives in the Bible. There's also a long history of midwives in the United States as well. So long before midwifery was a profession, there were granny midwives that attended births in the southern United States. And earlier than that, midwives were attending births in colonial times. The knowledge in those midwifery practices was passed down from a midwife to her apprentice. A lot of it was home remedies and herbal remedies. And so fast forwarding to the 20th century, nurse midwives were introduced in the United States in the 1920s. However, initially the legal authority to practice nurse midwifery was available only in a few states. Following decades of legislative action and work from women in this profession, nurse midwives now have the legal authority to practice and have prescriptive authority in all 50 states and in all the US territories. Since the profession's beginning, midwives have cared for members of underserved populations. It's sort of a hallmark of what we do. And so beginning with women, families in isolated mountain regions and places like Kentucky, people in poverty in crowded cities like New York City, women in rural and medically underserved places like New Mexico. Throughout the profession's history, midwives have continued to serve medically at-risk populations, and research shows that midwifery care provides benefits and improved outcomes to the people that they serve. Midwifery today is a healthcare profession whose members provide care for women throughout their lifespan with an emphasis on promoting and maintaining health. So preventative care at the forefront. Modern midwifery is recognized locally as well as globally, and it has standards for education and practice that make it a profession rather than an occupation or a vocation. All right, so we'll get into the types of midwives. So there are actually 4 different types of midwives. We're going to focus mainly on these 2 types, and we'll briefly go over the other 2 as well. But certified nurse midwives get a graduate degree from a university. They also maintain and hold a registered nursing license. So they have a bachelor's degree in nursing and then a master's degree in midwifery from a university. They practice in all birth settings, mostly in the hospital, but nurse midwives can provide care in home birth settings and birth center settings. And we are certified through the American Midwifery Certification Board, or the AMCB. Certified nurse midwives have authority in all 50 states and territories. Certified professional midwives have a minimum of a high school diploma, and their education is more apprenticeship based. So you apprentice under an established certified professional midwife for a period of time. They practice in home birth or birth center settings and outside of the hospital. They're certified through the North American Registered Midwives, or NARM, and they practice in about 35 states. Other midwifery disciplines, there is something called certified midwives. Certified midwives have a master's degree similar to certified nurse midwives, but their bachelor's degree or background is in a health-related field other than nursing. So they don't maintain a nursing degree, but they have training similar to certified nurse midwives, and they're recognized in 9 states in the District of Columbia. And then there are many places where traditional midwives still practice. So traditional midwives are midwives who, for religious reasons, personal, philosophical reasons, choose not to become certified or licensed. They believe that they're accountable to the communities that they serve, and midwifery is a social contract between a midwife and a client, and shouldn't be legislated. So all the midwives that practice with Trinity Health IHA are certified nurse midwives. All right, certification and accreditation. So the ACME, or the Accreditation Commission for Midwifery Education, has been recognized by the U.S. Department of Education as an accrediting agency for nurse midwifery education programs since 1982. The ACME makes sure that the quality of the education being taught to midwifery students meets the standards for education nationally. For certified nurse midwives, this means they have to complete their midwifery education from a university recognized by the ACME, and they have to pass an exam at the end of their studies that measures mastery of fundamental knowledge needed to ensure safe practice. These are all required for you to obtain a license, to obtain hospital privileges for deliveries in hospitals, and to care for our patients. In addition, certified nurse midwives need to demonstrate that they meet the core competencies for basic midwifery practice of the American College of Nurse Midwives upon completion of their midwifery education programs, and they must practice in accordance with those standards of practice by the ACNM. ACNM competencies and standards are consistent with the standards of the International Confederation of Midwives. And we renew our licenses every 5 years. So that was a long, wordy way of saying that nurse midwives have a formal education. There's a standard of care that we must obtain and maintain. And this ensures that we practice the latest evidence-based care. All right, the hallmarks of midwifery. The art and science of midwifery is characterized by 17 hallmarks. I'm not going to read them all to you today, but there are a few that I want to pull out as kind of standing out to us. The first one, recognition and promotion and advocacy of menarche, pregnancy, birth, and menopause as normal physiologic and developmental processes. And we take care of women through all of those phases of their life. Advocacy of non-intervention in physiologic processes in the absence of complications. And so that's a fancy way of saying not intervening if everything is going normally. Incorporation of evidence-based care into clinical practice. So we want to make sure that we're practicing with the most up-to-date information backed by evidence. Promotion of person-centered care for all, which respects and is inclusive of diverse histories, backgrounds, and identities. And empowerment of women and persons seeking midwifery care as partners in healthcare. So decisions are made together and not in isolation. And you can find the full list of hallmarks at midwife.org.
So a little bit on midwifery in Michigan. Nurse midwifery has been in Michigan for about 42 years. The first nurse midwifery practice started in Detroit at Hudson Women's Hospital in 1980. And since then, midwifery has really been expanding across the entire state. Currently, there are over 480 certified nurse midwives in every area of the state. In Michigan, CNMs are required to work with a collaborating physician to provide care for our patients. Some of the things that we might work with our collaborating physicians on are things like higher risk pregnancy, preterm labor, and things like that. But our scope isn't just limited to pregnancy and birth. All right. So now that we've kind of touched a little bit about history of midwifery, what midwives are, a little bit about our philosophy of care with our patients, which is really what sets midwives apart from your normal GYN care provider. All right. So we believe that everybody has the right to equitable, accessible, quality health care that promotes health and healing, care that respects dignity, individuality, and diversity. Information that is complete and accurate so that they can make informed decisions about their care. And it's really important to stress that all members of the team share these values, but as nurse midwives, this is something that is truly central to the midwifery model of care. Like I said, we work really hard to promote shared decision-making. As providers, we view our role as educators to help you make informed decisions about your care for yourself and your family. A lot of times this comes up in pregnancy and childbirth, because a lot of times people feel like things are happening to them instead of making informed decisions with their care provider. So that's something that we really strive to bring to our model of prenatal care. We believe that once we have educated you on the options, risk, that we support your final decisions. We believe that the best model for care for women and her family involves continuous partnership, acknowledges an individual's life experience and what they are really bringing when we meet them, when they're coming to us for care, that becomes individualized to their needs based on their past experiences. And our care really involves therapeutic use of presence and non-intervention when appropriate. So some examples of that comes up frequently with GYN care are people with a history of trauma. While nobody loves a gynecologic exam, sometimes this can be particularly triggering for those that have had a history of trauma. So we really try to empower the people that we care for to be in control of exams, including stopping an exam, making modifications, taking things slowly as needed to ensure that they aren't being re-traumatized when they're receiving care. All right. We also really want to honor the normalcy of pregnancy, childbirth, and reproductive care. Sometimes the things can go from normal to abnormal, which is where our midwifery training comes into play. Our job is to monitor for signs and symptoms that things aren't normal, educate you, collaborate as needed, and make a shared decision about next steps. At the end of the day, it comes down to getting you the safest, most effective health care that we can with childbirth and pregnancy in a way that you feel support empowered, and that can look like exclusive midwifery care or collaboration and referral as needed.
All right. So we're going to talk about some of the different spaces that you may see a midwife, and we're going to start with midwives in the hospital. So a common misconception when people hear midwife is that we only or that we primarily help deliver babies at home or in birth center settings. And in fact, in 2019, 89% of certified nurse midwives and certified midwives attended births in the hospital setting. This is compared to 9% attending births in freestanding birth centers and 8% at home. At IHA, certified nurse midwives only provide care to women laboring in a hospital setting. So most of the things, as with most things in midwifery, you can expect a CNM attended birth is a little bit more hands-on approach to patient care. We work with our patients through their labor, and we like to support them directly, not only just being there as the baby is being delivered. Midwives specialize in providing care to women who desire unmedicated birth experiences. So that means birth without epidurals. And we help support women specifically during that. However, that doesn't mean that if you want to have medication during your birth, you can't have a certified nurse midwife. So we can order pain medication in labor, and we can order epidurals in labor. And we support women just the same who want their birth experience to look like that as well. So if an epidural is what's right for you, then you can be taken care of by a midwife and you can still have one. We'll support you through that process as well. And so women cared for by certified nurse midwives of the same risk status compared to women cared for by physicians had lower rates of cesarean birth, lower rates of labor induction and augmentation, a significant reduction in the occurrence of 3rd and 4th degree lacerations, lower use of regional anesthesia or epidurals, and high rates of breastfeeding at 6 weeks postpartum. And so just some of the benefits of working with a certified nurse midwife, it definitely can provide a benefit to care.
All right, but like we've kind of somewhat touched on already, nurse midwives are not only in the hospital setting or so we can see in the office for prenatal care, obviously, but also for your routine well woman care from the time that you get your first period to the time that your periods stop at menopause. We can see it for things like pap smears, annual exams. We are recognized as primary care providers for individuals, like I said, through their entire lifespan. We conduct normal physical exams and can prescribe medications as well. Medications for things like infections, contraception, and even doing procedures for things like long-acting birth control, things like Nexplanons and IEDs. You can all see a nurse midwife for. Like I said, that midwives can really address your entire reproductive needs from before you're pregnant, during your pregnancy and postpartum, things like fertility, postpartum depression and anxiety. You can all see a certified nurse midwife for. We can also see things that are slightly out of the realm of what people might think of as normal, things like abnormal uterine bleeding and vaginal infections. If we can't directly treat it immediately, most of those things we can at least do the initial workup for and refer and consult as needed.
All right, we're going to talk briefly about the difference between OB care and midwifery care. So what is the difference between a midwife and an OBGYN? So a midwife has at least a master's degree and a nursing degree. Some midwives have doctorate degrees or PhDs in addition. Midwives specialize in low-risk GYN care and pregnancies, and we're really the experts in low-risk normal birth processes and supporting women through that. It's important to note that 85% of pregnancies are actually considered low-risk pregnancies. OBGYNs have a medical doctoral degree. They specialize in high-risk GYN care and high-risk pregnancies. They're experts in surgery, GYN surgery, and surgeries like C-sections during labor. So many factors should be considered when you're trying to select a provider, both for your well woman care and for pregnancy. You need to think about just your patient preference, your medical history, your risk status to start off with. These all go into the decisions women make when choosing an OB provider. And many women ask themselves, is a midwife right for me? And just considering the large percentage of pregnancies that are considered low risk, so many women fall under that category. And so a midwife would be right for you. Midwives are experts in low-risk physiologic labor and birth, and our physician partners are there for us and our patients when something falls outside that scope of normal. And so this comparison isn't meant to be like a midwives versus OBs. It's more we work together as a team. So our OB partners are one of our most valuable resources when caring for women inside and outside of pregnancy. And both specialties are needed and have a place in the world of women's health. And so it's when we use our individual training and strengths together that we provide the best care to our patients. So OBGYNs and midwives need each other. We're a team, and optimal outcomes for patient care and birth are achieved when certified nurse midwives work in conjunction with our supportive partners. And that's exactly what we do at IHA. So we have really close relationships with our physician partners, and they're there for us and we're there for them.
So in short, is midwifery right for you? Chances are yes. If you are someone that has identifies as female or as female reproductive parts that need health care, chances are you can see a midwife. And this includes members of the LGBTQ community who in the realm of healthcare are at higher risk of feeling judged, unsafe, things like that. Midwives are really specially trained and empowered to be able to provide non-judgmental, unbiased, safe healthcare to members of those communities. And if you're a person with a low risk pregnancy or low risk gynecological care, we are right for you. And at the end of the day, if for some reason during the initial care, things fall out of our scope of practice, we will get you the safe healthcare that you need with the work of our collaborating team. We have a couple offices with Trinity Health IHA Nurse Midwives in Domino's Farms, Chelsea, Livonia, and Bloomfield Hills. We are doing deliveries out of St. Joe's Mercy and St. Joe's Ann Arbor, St. Mary Mercy Livonia, and St. Joseph Mercy in Oakland. And these are really some incredible statistics from our IHA Nurse Midwives in Ann Arbor. In 2021, there were approximately 450 births, 389 of those being vaginal, with a 13% C-section rate. That statistic is particularly incredible because the World Health Organization recommends a C-section rate of less than 20%. So we're far surpassing that as nurse midwives. The C-section for primary C-section rate, so that being your first C-section, is 9.2%. The repeat C-section rate is 3.8%. So that's people that had a C-section with their first delivery and then had another C-section. Our VBAC success rate, or vaginal birth after cesarean, 75%. Only a 2.6% episiotomy rate. And then assisted deliveries or delivery with a vacuum or forceps is 2.2%, which again are some amazing statistics from our team. We currently don't have data for Livonia and Oakland regions as they're newer and still in the process of collecting those, but they're modeled after the Ann Arbor region and share some of the same policies and philosophies, so we can anticipate similar statistics to come. All right, and it looks like we already have some questions that we would love to delve into.
Yes, definitely. Thank you so much, both of you. Okay, so there are a few that came in while you were talking, so we'll jump right in, and as they roll in, we'll try to touch on common subjects that are coming up, and hopefully we'll be able to get through all of the questions, but if not, we will definitely do our best. Okay, yeah. So can you tell us, are midwives able to assess pelvic floor function?
So short answer is yes. We are generally able to kind of do the preliminary work in that, assess musculature, things like that, give you some preliminary tips and tricks to help improving pelvic floor. We are all huge fans of our pelvic floor physical therapists, who we also have great relationships with. So if some of our initial tips and tricks and suggestions aren't getting you to the function that you need, we often do refer to pelvic floor PTs if needed.
Okay, and you'll also refer, as you said, to an obstetrician as needed, correct? Okay, and there is a question about someone that looks like they're a patient at an OB-GYN practice from IHA, and she doesn't believe there are any CNMs there. But in many of our practices, we do have midwifery practices alongside the OB-GYN practices. Is that right? So I know there's in Bloomfield, right? And I know at Schoolcraft.
Yeah, we have locations at Bloomfield's, Schoolcraft, Domino's Farms. Um,
And all of those
All of it.
positions also
Sorry.
get the OB-GYN. Go ahead, Katie. No, you were probably going to say the same thing I was. Go ahead.
I mean, what I was going to say is that our midwife practices that we've established, the Ann Arbor one, the Livonia, and Oakland, are independent midwife practices. So if you choose a midwife, you come specifically to that practice. However, we all work really closely with the OBs that are also in those offices. And so in many cases, I know in the Livonia office, the OB-GYNs are in the same area of the office that we are. And so they're just very available to us, even though we're not technically the exact same practice, if that makes sense.
Yes, definitely. So that was sort of what I was trying to get at, that within the same building or very close by, you can get care from an OB-GYN as needed, and you guys work very collaboratively with them, especially in the same building. Does that sound like an accurate statement?
Absolutely.
Okay.
Correct.
Okay. So
Hey guys, this is Jen Kelly. I'm the site clinical director. Hi, I'm the site clinical director for the nurse midwives. I have done to assist with any questions that might come up. And for the Ann Arbor location, because there's so many physician offices, some of those physician offices do have nurse practitioners and midwives that practice within them, but they provide care in the office setting only. If you're looking for a midwife to provide care during the pregnancy, you would need to transfer care to one of our practices. And in the Ann Arbor region, for the patients that are delivering at Trinity Ann Arbor, that would be either our Domino's Farms location in Ann Arbor, or that would be, we also have a Chelsea location that we opened in August.
okay, perfect. So it sounds like it would be, should this person start a conversation with their obstetrician, or could they just contact a midwife practice on their own?
I think a great start is to have that conversation with their physician. Our physicians are very supportive of our midwifery practices, and they're great. They know very well what our what's within our scope of practice as well. So if they think that you're a good candidate, they will absolutely refer you over to our office to talk about that further.
Perfect. So we should not look at this as a rivalry, but more a collaborative relationship. Perfect.
Absolutely.
And can one of you tell us the difference between midwives and doulas? How are they related and how are they different?
Oh, I would love to answer that question. So a midwife is someone who gets a master's degree in midwifery care and provides actual medical care during your pregnancy. So we follow your pregnancy from start to end, sometimes even before you're pregnant, providing that well woman care on into your pregnancy and then after you're done with delivery. We can prescribe medications. We monitor the normalcy of your pregnancy and provide interventions if needed. And so it's medical care that we're providing. Doulas are trained to provide labor support. So doulas are not like medically certified individuals. They their specialty really lies in supporting women in labor, helping them cope with things like unmedicated labor, or if they're having problems progressing in labor, position changes, and just providing comfort during labor. And there are also doulas who provide care postpartum as well. So being that supportive person in your home to help with breastfeeding and things like that, but they don't have a medical degree. Is there anything you want to add, Lexi?
Oh, just adding that I don't want people to think like you have to choose between a doula and a midwife, just like you don't have to choose between a midwife and an OB-GYN. We have great relationships with a lot of doulas in the community and really enjoy working with them. A lot of times they are just able to bring the extra support, guidance, and things like that to the labor that can be very beneficial.
Yeah, they really provide like a complimentary service to us. I mean, a doula is generally someone that you hire to attend your labor with you. A lot of times you have pre-labor visits with them and then postpartum visits as well. But a midwife and a doula aren't mutually exclusive choices. We work together with them. And it's really common that someone who chooses a midwife for their care provider also plans to have a doula at their birth.
Okay, amazing. And it makes me think of all the conversations I've had with friends, and I've even experienced this myself, where I felt much more prepared for the birth of my second child versus the first. And I just think what an incredible thing to have this team of people to support you on your first pregnancy or first birth. It's just like such an amazing thing. I wish I could go back in time and do it over again.
It definitely takes a village for sure.
Yes, but it's just so inspiring. It's really cool to see. And all the things that go along with just being pregnant and having a baby and actually delivering. There's just so many steps to it. So it's just great to have such a warm, expert to really be there to support. So we have a lot of questions about care kind of leading up to pregnancy, throughout pregnancy, and then postpartum. Can you talk about what like a typical care plan would look like maybe for somebody who's newly pregnant or hoping to be pregnant soon? And I know maybe some people might have some experience with like OB having that typical, I think what is it, like a 6-week appointment postpartum. So just kind of talk about, what it looks like with a midwife, and does it differ from the typical OB schedule?
Yeah. Schedule wise, it's fairly similar. Generally, when you get that positive pregnancy test, you'll call the office, they'll schedule you around, 8 to 10 weeks for your initial OB, where we'll really kind of dive into your history, to know you, any previous births that you've had, learn about that. And then we see you about every 4 weeks until about 30 weeks. And then every 2 weeks until last month of pregnancy, where we're seeing you every week. And then generally there is a 6-week postpartum visit as well after the delivery. In some cases, though, we will also do a 2-week visit. The biggest difference with it is what happens in the visit. Generally, the feedback that I get is visits with the midwives are more person-centered, really getting to know you and what you want your birth experience to be like, and kind of developing those goals for pregnancy, delivery, postpartum. And there we just tend to be experts in navigating some of the psychosocial things that pregnancy can bring up for everybody. I don't know if you had anything else to add, Katie.
Yeah, I think we may have lost Katie for a moment. Hopefully she'll be able to jump back in. So when it
I'll add real quickly if you don't mind. Just a couple quick things. That was a great rundown of typical visits. We do tend to have longer appointment slots for both your initial OB visit and for return OB visits, which just allows a little bit more time for education, answering questions, and really getting to know. A lot of times, I think we spend a lot of time helping people through any psychosocial issues, any mental health, those kinds of things. So we really are happy to have that extra amount of time to spend with patients. In that postpartum period, like Lexi said, we typically have a 6-week checkup, and then there's often different intervals that we may see you for, whether there were blood pressure issues during the pregnancy where we'd want to keep a closer eye on that postpartum. We often do Zoom mood checks with patients so we can check in and see how things are going emotionally without having to pack up the baby or find a babysitter, and other types of interval follow-ups in that postpartum interim.
I love that. I don't think I've ever heard of the Zoom mood checks, and that's such an amazing thing to do for new moms.
They are great. It was born in the age of COVID, and we have continued it, and it's been just a blessing.
Yes, definitely. I could see that being a huge positive to having a midwife as your caretaker there. So could someone choose to work with a midwife and an OB-GYN at the same time as they're pregnant, or is it kind of one or the other? How does that work?
So I will say generally for low risk pregnancies, it tends to be one or the other. If things develop throughout the pregnancy, that we need a closer eye, second opinion, in those kind of situations with things like blood pressure, or other medical things that could come up, you might definitely be seeing both, an OBGYN and a midwife.
And
So what's great about our practice, sorry to interrupt, what's great about our practice setup is all of the locations have a physician liaison. So we have one specific, all of our physicians are very supportive and helpful, but we have one very specific person for each location that is our go-to for patients that develop more high-risk conditions during pregnancy. And we have really clear protocols on how to handle that throughout the whole IHA OBGYN division. So how those things are handled is very clear, whether you're seeing a physician or a midwife. We'll often lean on our liaison when we have a patient that's more high risk. We have great maternal fetal medicine physicians that all of our patients see, whether you're seeing a physician or a midwife when you have higher risk conditions. And then in certain cases, things like if you've had a C-section in the past and you're considering trying to have a vaginal birth after cesarean, we will offer a consult with with one of the physicians to kind of talk about pros and cons and risks, just to help you have one other piece to help you make that decision.
great. And so if you start your pregnancy and you are already at high risk and you're working with an OB/GYN, can you involve a midwife throughout the pregnancy or even the birth? Or is it typically when you're high risk, you kind of stick with the OB/GYN?
I would say it depends on the case, but it definitely does not completely eliminate the option of midwifery. If you're somebody that started with an OB and thinks that you might be at higher risk, or started with an OB in general and are interested in midwifery, I would recommend just starting off having that conversation with them on if, could a midwife be a part of my team? And like I said, that involvement can range from every couple visits, seeing an OB versus a midwife, or it could just be a collaboration where we're just having to pop in our heads down the hall to talk to our collaborating physicians on some things that come up. So it's really a case by case basis, but we generally never say never.
Great. And if you are working with a patient throughout the entire pregnancy, are you going to be the person that delivers that baby, or will it be somewhat like an OB where it's kind of whoever's on call that day?
Yeah, so generally we do have a scheduled where we divide call equally. The nice thing about the midwifery practices is they generally tend to be a smaller number of providers. So the odds that you have met the provider that will be at your birth throughout your pregnancy is a little bit higher. Like I said, the Schoolcraft and Bloomfield offices both only have 3 nurse midwives versus a call group and OBs that could have a larger number. And throughout your prenatal care, you have the option of sticking with one midwife, or if you're wanting to put a face to everybody, making an appointment with everybody. The great thing about midwifery is whoever ends up being at the birth is generally going to have the same philosophy of care, which I think is really great. It's generally just tends to be a slight difference in personalities. So.
Okay, perfect. Jen, were you going to add something? Sorry, I keep interrupting you.
No, actually I wasn't. I thought that was a really great answer. The only thing that I will add is, in the Ann Arbor region, we do have a larger practice, but in the almost 9 years that I've been there, our patients, I've heard such positive feedback, whether they were cared for by a midwife that they had met prenatally or someone that they've never met before. And I think that we're able to provide that really high satisfaction of care because of a couple of things. We communicate really clearly in the prenatal chart about any specific wishes, birth plans, any things that are really important to the patient. So we try to make it easy for patients to not feel like they have to rehash things every time they meet a new midwife. But also, what I love about how we practice is we don't come to work we come with a huge set of tools that we can use. I'm not coming there to tell a patient that they should or should not have an epidural or should do things naturally. We come with a set of tools that make us able to provide excellent prenatal or excellent labor care to you, regardless of how you're approaching your labor. And I think that's how all of us midwives practice. And that, I think, is where the high satisfaction really comes with our practice.
Yes, I love that, as Lexi pointed out, that shared philosophy of care, I think is so important. And I do agree. I think as you, because you're going to spend a lot of time in the practice if you're pregnant, especially. And I do think that it's great that you can get to know the staff and the midwives that are working there so that it won't be a surprise as much as, you know, if you got someone from a larger practice that maybe you don't know as well. Okay. Can you talk about when you might consider some interventions when a woman is overdue? So like how far past the due date would it be time to intervene?
That's a great question. So we do have protocols that have recommendations, and it's based on safety near the end of pregnancy. In general, we prefer that our patients be delivered by 42 weeks, but we will consider a post-term induction anytime after 41 weeks. Sometimes there's indications to do that sooner. And we do allow elective inductions if patients are requesting to be delivered for other reasons after 39 weeks. We often, though, do have patients that prefer to not be induced, prefer to delay that. And what we do then is talk real carefully to them about pros and cons, about any risks, and offer monitoring, things like non-stress tests where we watch baby's heartbeat, and an amniotic fluid index, which is an ultrasound where we look at the fluid around the baby, which gives us reassurance about how baby is doing and how the placenta is functioning near the end of the pregnancy. And then with that information, we help the patient decide when the right time is, if her body isn't choosing to go into labor on its own, when the right time is for induction based on those risks.
Okay, excellent. And you talked a little bit about some of that imaging, the ultrasounds. Is ultrasound in lab and any other testing typically done in the same schedule as is with an OB, or is there some kind of a difference between those labs and things when you're working with a midwife?
Yeah,
We
so
follow the same. Oh, go ahead.
I say generally we follow most of the same recommendations in terms of ultrasound. There's like the initial dating ultrasound and the big head to toe ultrasound, and others as indicated medically through some of that shared decision making that we talked about. Same with labs. We're going to follow the same protocols for what labs to draw when. I would say sometimes compared to other practices, our practice tends to follow the recommendations from some of our governing bodies in terms of timing versus some other practices that might be a little bit more liberal, requiring scans and labs more frequently.
We also, I think with our population, tend to have more questions about the necessity of some labs and ultrasounds. So we definitely spend a lot of time when patients have questions about those things, explaining what the indications are, explaining risks if they're declining certain types of tests, and just really trying to make them be really well informed of why there's recommendations.
Okay, and from a convenience standpoint, there are labs within the medical centers for several practices, and then some, however, I don't believe have labs. Am I right on that, or am I wrong on that?
I know that Livonia has a lab in the Livonia building on Schoolcraft, and the Domino's Farms location has a lab on the first floor when you come into Domino's Farms. Lexi, can you speak to the Oakland region and maybe Jen, the Chelsea building?
Yeah, we don't have one right exactly in the building, but they're not far, and we have several that are super convenient for getting them drawn where needed, very nearby.
Great.
I do not believe there is not a lab at the Chelsea location, but this brings up a great point. So many of the places where we practice do have other specialties, including general practice, physicians, midwives can do a lot of primary care, but if you break your foot or there's certain things, we're going to refer you back to a PCP. And we have pediatrics in almost all of those sites as well, which is super convenient.
Yes, definitely. Definitely. It's nice to be in one big family.
I also will say that if maybe you live in a different city, but you're coming to the Livonia building for your prenatal care, and it's more convenient for you to go to one of the many other IHA locations that there are. Like maybe there's one in your city that doesn't provide midwives, but you're coming to see us in Livonia. Any lab that we order, you can get drawn at any IHA lab. And so you can go to the lab that's most convenient for you if that's what your choice is.
That's excellent. Thank you for adding that in. Yeah, so it sounds like it's pretty convenient at most of the practices. Let's see. So do you allow moms to decline the glucose test?
I'll talk about that one. So that's actually something that I'm working on right now of some options. Our goal with glucose testing is really making sure that important screening is not missed on high-risk populations. In general, the recommendation from ACOG, from CNM, is for patients to be screened at the 26 to 28-week interval to screen for gestational diabetes or diabetes of pregnancy. We do have some patients who decline that testing who are concerned about having that testing simply because they don't want to put that much sugar in their bodies, or the specific glucola test that they don't want to put the artificial items that are in that substance in their bodies. And I recognize that. So we do have one alternative that's currently available to all of our patients. If they want to do home glucose testing, we spell out what that process would be in terms of doing their own self-testing and avoiding the glucola drink. We're also working with all of our labs and pathology leads right now in trying to find alternatives for women to use. That's something that is currently in process. Like I'm scheduling a meeting right now. So it's something we've been working on really hard, trying to advocate for our patients, because we just recognize that that's something, when you're trying to make really healthy choices in pregnancy, we want to respect that. So that's something that we're working on. Some patients, when given different options, do decline to have that testing. And that's something that we would then talk really carefully with you about your specific risk based on your health, based on a large number of variables. And then we would evaluate whether you're still considered a low risk patient in terms of us being able to provide care to you in the midwifery practice, and then just decide if that's something we can safely continue to do. So we try to really meet people where they are, give them good information on what the reasoning for the testing is, give them alternatives, and then find a way to just make sure that their pregnancy is remaining really safe.
Excellent. And I've never heard of this. So is the fresh test, would that work for glucose testing?
That's one of the things that we're working on with pathology. So that's a to be continued answer at this time.
Okay, sounds good.
You guys are on it, this
I-
audience. I'm very impressed, very knowledgeable.
There's so many good questions.
But I'm glad to see that we're addressing the issues that are important to our patients too, and potential patients.
Definitely. How about the policy for breech babies?
Yeah, we get breech babies sometimes. So when we discover that, we spend a lot of time talking with patients about things that they can do in terms of positioning. We refer you to the Spinning Babies website, which is a great site for lots of knowledge on how moms can try to change their baby's position safely. We have chiropractors, acupuncturists, moxibustion practitioners that we can refer people to. But if that baby stays stubborn, we do offer to schedule an ECV, an external cephalic version at the hospital, scheduled with one of the OBGYNs. Quite often, one of us midwives would be the ones that would assist that procedure, where we talk through risks and benefits and we try to turn that baby. So we do have lots of options to try to turn babies. If the babies don't turn though, we would have to schedule you for a C-section.
Oh my gosh. Those
Yeah.
babies.
Yeah.
Okay. So one person is saying, so she lives in Flint, and being able to drive in for an appointment at any of our midwife locations is a little bit too far for her, but she does want to have some combination of midwifery care. Do you have any recommendations for her on how maybe she can incorporate midwives into her care?
Is she asking about midwives in that region?
I think what she's saying is that she goes to the Brighton OB-GYN office.
Oh, okay.
And she would love to have midwifery as part of her pregnancy and part of her experience. Is there a way that she can incorporate that?
If you're committed to having your visits at Brighton, we unfortunately don't provide care in that region right now. We're always looking at, where is the right next place for us to try to expand our location. But right now we don't see patients there. They do have a great nurse practitioner there, Paula Blankenship. So if you're looking for that advanced practice nurse approach in terms of prenatal care, I can highly recommend her. She was actually just voted Livingston County's top advanced practice nurse, I think was the title. Or if, as you get near the end of the pregnancy, if you were then willing to make those drives to Domino's Farms or to whatever location, if I'm saying Domino's Farms, because if you were planning on Trinity, Ann Arbor, but if you knew what hospital you certainly wanted to go to, you could talk with your provider about being a bit later in transferring. We really do recommend you not waiting too long, and usually 36 weeks is kind of where we try to have you make those decisions by that point. But that's something that you could consider doing, just, transferring near the end of the pregnancy. But I would talk to your provider about that.
Okay. How about genetic testing? Is that available when working with the midwife?
Yeah, midwives can definitely order genetic testing, both on parents and babies. During your initial visit, when you call, you'll be talking to a nurse and she will kind of talk through some of those options with you. And at your initial OB visit and maybe the visit after, you can discuss that more in depth with the nurse midwife, what that looks like and involves. But yes, midwives are able to order those same tests, and not just when it comes to genetic testing, but generally lab work, imaging. You'll be hard pressed to find a test that a midwife wouldn't also be able to order during pregnancy.
I will say that when it comes to genetic genetic testing. We order genetic screening tests to check for the risk of things or your carrier status for certain disorders. But if one of your genetic screening tests came back high risk for something for your baby, a referral is placed to maternal fetal medicine to get diagnostic testing. So midwives don't perform, at least at our locations, diagnostic testings for things like amniocentesis and things like that. Those are performed by maternal fetal medicine doctors.
Okay, but the midwife definitely gets you to where you need to be. Okay.
Absolutely.
Yeah, great. I know you talked throughout the entire presentation about how personalized this care really is. So we have someone who's saying she definitely wants an epidural. She knows that going in, but the rest she's pretty flexible. So it sounds like that as long as it's low risk, that could be someone who could investigate relationship with a midwife.
Absolutely. We definitely care for people that know going in that they are absolutely going to want an epidural. The nice thing about even with planned epidurals, sometimes the midwives are just able to provide that individualized support and care in the labor process up until the point where you're wanting to get the epidural, things like that, and give you alternatives to in early labor, cope with labor and pain until you're ready for that epidural.
And does that labor care also include, is it a labor nurse, or does the midwife sort of take the place of that person?
No, our labor nurses are, yeah, they're invaluable. We absolutely lean on them, just like our OBGYNs do. Absolutely. So you'll have your labor nurse caring for you and your nurse midwife. And even if you've gotten an epidural, there's a lot of knowledge that we have about different positions that we can utilize, even with an epidural, to help with the baby turning into the right position, help with fetal descent, to help things keep progressing, even when you're stuck in bed with that epidural. There's still a lot of knowledge that we can use to help.
Excellent. So I think we touched on most of the topics or themes here in the questions. There are a couple questions about insurance and some of the cost for having a midwife versus OB. And I would say any questions that you have regarding your own insurance or your own coverage, I think it's best to give a call and let the staff know and give them your information, because they are really the experts in the billing side of things. So I always encourage people to call and find out, because it's so hard to answer. There's so many different plans and so many different pieces to everybody's plan that we just encourage you to call the experts at the staff at the front desk.
Yeah, our reception staff is exceptional. They really are very knowledgeable of different insurances and can answer questions or point you in the right direction. And I can't think of any additional charge that there would be for receiving midwifery care.
Excellent.
I just wanted to touch on the question that was emailed in ahead of time.
Yeah, go for it.
When somebody had emailed specifically related to some more extensive tears from previous deliveries. In general, like we kind of touched on in the PowerPoint, deliveries with the midwives are associated with lower risk of tearing. And in the course of the prenatal care, we would kind of be able to delve into with the history of a severe tear, options for delivery, and the risk of possible tearing versus cesarean. But we, throughout the delivery, have lots of tips and tricks, including positions, warm compresses to help minimize tearing during delivery.
So when you talk about positions, that can actually really change the outcome of your delivery and your recovery. Oh my gosh.
Absolutely. There's the statistics show that like delivering or laying on your back, like you see in most of the movies, can sometimes be associated with higher risk of tears and things like that. So we can come up with kind of an individualized game plan that promotes comfort with goals of minimizing tearing. And even if you do end up delivering on your back, we definitely have lots of tips and tricks to help minimize tears.
It's just amazing how much you can care for someone with all of your history and your knowledge and everything, and you can really make such a huge difference in their whole experience. I mean, giving birth to your child is such a big thing, and it's just so nice that you can make it so much more comfortable and just make it a more smooth experience, or as smooth as it can be, I guess.
Thank you for those kind words. That's definitely our goal as providers, is to honor and respect and give people the experience that they're looking for, that empowers them. And yeah,